February is Heart Health Month, and it's an important subject. Heart disease is the leading cause of death in the U.S. Today, our medical expert, Dr. Payal Kohli, is here to talk about silent heart attacks. Dr. Kohli, I have somebody in my life, my dad, who had one apparently. He says he did not. How do we know what they are, and why should we be concerned?
Well, we should be concerned because 20 to 45% of heart attacks are silent. And so it's a lot more common than we think. And for many of us, we tend to blow off symptoms if they're very mild. And in a silent heart attack is damage to the heart muscle, usually leaves behind scar tissue on the heart. There can either be no symptoms or very mild or very atypical symptoms. So you could feel a little indigestion, a little heartburn, something like that. And when I have patients that come in, I had one just this morning that came in, her EKG showed me a silent heart attack. I said, looks like you've had a heart attack. And she said, how's that possible? Then she thought back to an episode where she felt a little off, she felt a little heartburn, lasted a couple of days. She kind of blew it off and said it must have been something she ate. But it was a heart attack.
It's funny, people may hear this and say, silent heart attack, what's that? But just at this table, you talk about your father. I had a friend recently, a dear friend, who walked around for a couple days thinking it was nothing, went and was told he had a heart attack. Yeah. And so this is obviously more common than not. Who's more susceptible to this? Who's more at risk?
So, you know, Kim's dad is an older man. So older patients are much more likely to have this because they just don't feel pain as much. Diabetics can get what's called an autonomic neuropathy or a neuropathy, which changes the way they feel pain. So they're less likely to have the classic elephant on the chest sort of symptoms. Women because they feel pain differently. Women because they have more atypical symptoms like fatigue or back pain or jaw pain or little shoulder uneasiness or that heartburn. Ooh. And women because they put up with more. And so they tend to minimize their symptoms more. And then actually anyone who struggles with chronic mental health issues because they're not as attuned in terms of insight into what's happening with them. And the problem here, guys, is that time is muscle, time is heart. This is why we rush patients in an ambulance when they're having a heart attack, because we've realized now that if you open up that blood vessel and that blockage, you could take something that could have been a massive heart attack and turn it into nothing at all. And so minimizing and sitting on it and saying, let me wake up tomorrow morning and see if it's still there is always the wrong thing to do. So I tell my patients, pull the alarm. False alarm is much better than missing a heart attack.
So how do you know if you know, to be fair, a lot of people would go through life going, I just ate something that didn't seem right to me. Right. How would you know if you had one?
So I would say think about your risk factors. If you fall into one of those categories, then have a lower threshold to not blow off any symptoms and talk to your doctor. And then even if you don't fall into those categories, probably once a year you should check in with your doctor. But the way that doctors know if you had one is we look at an electrical map of your heart called an EKG, and that pattern can sometimes look different. So once a year, most older Americans should be getting an EKG. We can also do an ultrasound of your heart called an echocardiogram that can show a piece of the muscle is not moving as well. Or we can do a stress test or an MRI that shows a little scar tissue on the heart.
If you're in one of those categories that you just explained to us are more at risk, is there something you can do at home, you know, if you're now worried about this because you're in one of those categories, whether it's a tracking device or something, or do you just have to go?
No, so your 80% of heart attacks and strokes are preventable with risk factor management. And that's the takeaway message, is that every American needs to actively think about their heart attack risk and manage their risk factors. Some are lifestyle risk factors, some are, our blood pressure or cholesterol or blood sugar. The trackers really help us to know how active we're being, if we're getting enough steps, if we're getting enough sleep. But it's really important to do that because these silent heart attacks can actually be worse than a regular heart attack, because guess what? The doctor doesn't know, you don't know, so we didn't institute the right medications after you had your heart attack. That heart attack kind of matured and left scar tissue behind, so it could cause long-term complications like heart failure or arrhythmias, which are electrical problems. So the more you can do, like you said, Phil, to prevent this, get ahead of it, and even if you felt something, go and get it checked out right away, the better.
Because if you had like a couple of those, then do they each time cause more damage?
They do, and you don't know them. So you're one of those people that doesn't declare themselves, right, when they have a heart attack. And so when I find my patients with silent heart attacks, I'm even more worried because they may not have symptoms. They may have very minimal symptoms. So I actually have to try a little harder to make sure I prevent even more in them, because they could keep having them again and again. They still have those risk factors.
Wow, so you could have that episode, then move on with your life until you have another episode. That's scary. So that's why you go get checked.
That's exactly right.
Dr. Kohli, thanks as always.